I'm Yonatan Shaleve, an internal medicine resident in Beilinson Hospital, Petah Tikva, Israel. On behalf of my co-authors, I would like to thank Endoscopy Journal for accepting our article, Computerized Image Analysis of Blood Vessels within Mucosal Defects for the Prediction of Delayed Bleeding Following Colonic Endoscopic Mucosal Resection, a pilot study. Clinically significant post-endoscopic bleeding is a common complication following colonic EMR and has a significant morbidity and mortality associated with it. The current prediction tools for this delayed bleeding are clinical, and they don't take into account the appearance of the post-EMR mucosal defect. In recent studies, it was found that the prophylactic clipping of visible blood vessels within the defect was effective in preventing delayed bleeding in high-risk lesions, and the correlation of the defect vascular architecture may potentially assist in decision-making regarding prophylactic treatment or the close monitoring of patients with high-risk lesions. Our aim in this study was to examine if morphometric analysis of the post-EMR mucosal defect and the visible blood vessels within it can be used to predict delayed bleeding. This is the first study to our knowledge using morphometry to quantitatively analyze blood vessel morphology in relation to clinically significant post-EMR bleeding. Using this method, we discovered 5 independent morphometric variables able to successfully predict delayed bleeding with a sensitivity of 86% and specificity of 76.7%. We additionally performed a neural network statistical analysis that yielded a 100% sensitivity and 76.9% specificity for correctly identifying patients at risk of delayed bleeding. Further large-scale prospective studies, including risk stratification using both clinical and morphological features and using prophylactic intervention based on risk analysis, are required to verify this hypothesis. To conclude, our proof of concept study shows that morphometric characteristics of blood vessels in the post-EMR defects can be used to predict delayed bleeding following colonic EMR. In addition to this, we believe that our study showcases the potential of endoscopic image analysis as a tool with great future promise in many other fields of endoscopic research. I would like to thank my co-authors and again the Endoscopy Journal for allowing us to showcase our research.